What is sciatica? It's a bit of a catch-all term. So let's talk about that. Hi, I'm Dr. Ken from Spinal and Sports Care Clinic here in Spokane Valley. And today we're talking a little bit about sciatica. What is it? Where does it come from? And what can you do about it? Sciatica is a bit of a garbage term. I don't mean that offensively. I'm just saying that it is a catch-all for what? Leg pain. People even use it to describe it, my patients do at least. They use it to describe pain just in their glutes. That's not radiating down their legs. This is why it's not the best term to use, but it is often used to describe any sort of symptom in the low back or in the legs. So let's talk a little bit about what sciatica is or isn't and what it could be, and maybe some more specific things that it could be. The reason that I don't prefer the term sciatica is that there are a lot of structures in the spine, in the skeleton that could be causing pain in the glutes or in the legs or even in the back. So using our handy dandy pelvis model here are just a couple of the structures that could cause pain. So your SI joints between the sacrum and the ilium here, that joint, the sacroiliac joint, that can cause pain that radiates down into your leg. The hip joint can cause pain that radiates down into your leg. It doesn't typically cross the knee, but it can. I've seen it do that before in really bad cases. Up above here, we've got the lumbar facets here. These are the joints. Those articulate with the lumbar spine. When we stimulate those in pain studies, those can cause pain into the leg, even past the knee sometimes. Not always, but sometimes. And then not shown on here are the nerves. The lumbar spinal nerves, the nerve roots as we call them, right where they exit the spine, they can get inflamed and irritated and they can refer pain down the leg. The sciatic nerve itself, which is not the same as the nerves coming out of the spine, the sciatic nerve is a group, well, it's one large nerve that's comprised of 4 or 5 nerve roots, 3 or 4 nerve roots. And that goes down underneath the piriformis muscle into the thigh, branching off as it goes into various nerves. That can be irritated as well. And that we would call that a peripheral neuropathy. That's the nerve is being entrapped somewhere outside of the spine. That could be from the piriformis muscle. It could be entrapped in the thigh. There's other things. There's also the femoral nerve, which comes out to the front of the thigh. That can be irritated, though that one is not nearly as common. There's also a nerve that can get entrapped on the lateral thigh. That one is just a skin nerve, and that one is pretty common. I see that quite a bit. And that just manifests itself as numbness or pain. The point here is that there's a lot of structures that can cause leg symptoms. So when we say sciatica, the first thing I think of is, what is that? What is that sciatica? One of the things that we pride ourselves here at Spinal and Sports Care on is doing thorough examinations. And what I've just talked about is that's why, right? We need to know what the problem is so that we can tailor the treatment to the problem. If we're going to be effective at treating your leg pain, we got to know what it is. I haven't even mentioned muscles yet. Muscles, trigger points in the glute muscles can send pain down the legs. You could have a hamstring strain that could cause pain in the back of the thigh. There's at least 10 things there alone. So that's one of the things that we really emphasize is, you need a proper diagnosis first. Otherwise, we're just throwing things at the wall and hoping it sticks. That doesn't work, okay? Typically, if I was going to pick the most common diagnoses, I would say that the first thing I think about is nerve, because if you miss a nerve problem, it has pretty big consequences. So I always like to make sure there's not a nerve problem. After I rule out nerve problems, then I think about joints. I think about the SI joint, especially if you're a gal. Gals tend to have more SI joint problems than guys. And then I think about the lumbar joints. And then I might think about the hip, depending on how old you are. It could be osteoarthritis in the hip. It could be impingement in the hip. If you're an athlete, there's all sorts of things. So kind of in conclusion, a really good evaluation is key to managing these problems. And so that's kind of our approach here at Spinal and Sports Care. I hope that clears up any confusion about the word sciatica. And if you have any questions about that, you can always call our office, and we'll be happy to try to help you as best we can.